I want to welcome you to the HIV Treatment Prevention Workshop. I want to thank you for being here. It's really an honor and a pleasure to host you. As you know, this meeting is the result of a significant investment effort that we have put together with the help of our many sponsors and colleagues. So before I say a few remarks, I wanted to acknowledge them for their support. The sponsors are listed here. The co-hosts of the meeting are the International AIDS Society, UNAIDS, and the National Institute for Drug Abuse. The co-sponsors include the U.S. President Emergency Plan for AIDS Relief, the Office of AIDS Research, the National Institute of Allergy and Infectious Diseases, the NIH, Bill and Melinda Gates Foundation, the ANRS, and the Canadian Institute for Health Research. The local academic partners include UBC, Simon Fraser University, Providence Healthcare, and Vancouver Coastal Healthcare, which is responsible for healthcare in this region in the province. And the major industry sponsors include Abbott, Bristol Myers Squibb, Gilead, Janssen, Merck, and ViiV, with additional support also from Biolytical and Boehringer Ingelheim. I want to thank especially the IAS, and in particular Eli Katavira, the co-chair of the meeting, who is here with us today. He will be taking the podium a little bit later. I also want to thank the Scientific Advisory Committee that is listed in this slide, who has been responsible for putting the program together and helping guide the content of the conference, including the review of abstracts and the placement of the different materials in the program. All of the success of the program is as a result of the hard work of this group that you have in front of you. As I was thinking about the meeting, I couldn't help but remember what it was like a year ago when we met last, nearly a year ago. It was actually the week before the release of the HPTN studies. Don't worry, I'm not going to give a lecture here. I just thought I'll highlight a few things. But it's really remarkable how HPTN, 052, and Myrod's work has galvanized the field of treatment as prevention. Certainly the efficacy in terms of transmission and the clinical outcomes in that study fueled the statements that we heard of late last year from Hillary Clinton on behalf of the American administration, and more recently President Obama with his sort of pivotal address on December 1st last year, which I think is sending a clear message that the political leadership that we need to move this agenda forward is there. I only wish my own Prime Minister would be listening, but hopefully in due course that will come to be. I think that the events over the last several months show that we are in the right direction, and hopefully pretty soon we're going to see further action. All of this culminated with treatment as prevention being acknowledged as the breakthrough of the year by Science and a number of other journals around the world, something that makes us all very happy. We're very pleased about that. And so the next steps are really fairly clear for us. We need to do more of what we know it works. And in that context, testing and certainly treating or offering treatment to people with HIV becomes a huge priority to contain the epidemic. The IAS guidelines, the IAS USA guidelines, have been sort of advocating for treatment for prevention for some time, since the 2010 version published in JAMA back a couple of years ago. I'm delighted to see that the DHHS has moved in the right direction and has basically embraced the same notion. So really, at least in North America today, we have a broad consensus. Treatment initiated early is being recommended all the way for people even with high CD4s, as you see here, and treatment as prevention is being recognized. In the case of the DHHS, they actually made the point among heterosexual and others, as you see here. Actually, a few days ago, and I'm sure Godfrey is going to talk more about this, the WHO came on board with their guidelines, which I highlighted in this slide, is really a step in the right direction. And this opens the door for us to do more of this kind of work, not just in the north, but also in the south of the world. But I wanted to point out the fact that there are still huge gaps in terms of addressing the full of the cascade of care, the necessary support for people to engage fruitfully on antiretroviral therapy. And that's the work that I think is going to be our challenge in terms of how are we going to ensure that we do everything possible to bring people and treatment, testing and treatment all together, but at the same time to support them so that they can do this fruitfully and ultimately successfully. I thought I'd take the freedom of show a little slide. This is Tony Fauci, who we all respect tremendously, talking about an issue that has been controversial in some, you help me, been controversial in some areas, but I think that it illustrates, is it working? Otherwise I had to say it myself. I promise you, you're going to get to see this whether you like it or not. We tested it. Let me try this. Wait. All right. Okay. I promise you, you get to see it eventually. So on that note, I'm glad you enjoyed the video. On that note, let me just move on and hey, there you go.
And the idea of the tension between treatment and prevention, we should just forget about it and just put it behind us, because treatment is prevention. It shouldn't bump other prevention modalities at all, but treatment is prevention. And one of the things I said in the discussion a little while ago, again, I just want to say it because sometimes when I even talk to people who are not in the field, they don't get it. They say, well, this was done in a discordant couple trial. So if you're infected and you're having sex with an uninfected person, by definition, that's a discordant couple. So I think what we really need to do is to just take that data and run with it.
Good. So that's the instruction from the boss at the NIH for all of us. On that note, let me just end by saying that if we're going to deliver on the cover of the economies, we need to get our job done, we need to get it right, and we need to build on the data that we have generated so far to hopefully maximize the impact of the intervention. On that note, I believe you're going to introduce the next speaker.